and drive forward to do better on this journey. We have a special guest here today. Her name is Janice Guider. She will talk about what the data says with regards to impacts on the Black community. She will also talk about health equity, the barriers, and how we get around those barriers. I'm also very excited. We have a panel today of healthcare professionals, women who are a part of our ministry here at Main Baptist Church. So we're excited to hear their perspective about the lessons learned on the COVID-19 journey. We will also have time to review facts and myths because we all know that information is power. Following that, we will have a Q&A session, followed by an encouraging word from Minister Brandon Casey. We will wrap up today's conversation sharing with you tools and resources to further ourselves on this journey and to be as healthy as possible. So before we move forward, we want to take a time together and pray. So I'm going to ask Minister Casey to open us up in a prayer.
Father God, we come this afternoon to thank you. We thank you for this day. We thank you, Lord, for this opportunity that you've given us to come together, Lord, as a ministry, even as a community, Father God, and to be able to share information, to share resources, to encourage the people of the community, Father God, as we continue to travel on this journey, Father God, faced with still the prospect of COVID still being a reality, Lord. And we thank you, Lord, for the voices that you will hear on today, Lord, the information that will be shared. Thank you, Lord, for the vision for this, Lord. And we just ask that you would allow it to be profitable, Father God, and edifying and encouraging, Father God, to the hearts, ears, and minds of all those that are receiving of this information on today. We thank you. We ask that you continue to bless Pastor Spencer, Pastor Dallas, the Main Baptist Church, and even this committee, Father God, and we'll be so ever mindful to thank you. In Jesus' name, amen.
Amen. Thank you, Minister Casey. So now I would like to go ahead and introduce our guest speaker and our panelists. Janice, please kick us off.
Thank you, Shantae. Last night, the ladies and I met, and I told Shantae, whatever she does, do not call me special. Okay, I'm not special. I am one of you. And several months ago, sitting in front of the television, watching the incessant news programming and special health alerts about COVID, and realizing what COVID was doing to our community, it hurt my heart. And I began to pray, and I asked God, you got to give me something to do, a way to help my people. Previously, I have worked in several health promotions and projects that primarily benefited others who don't look like us. And at this point in my life, I felt a need to focus more on what the young minister just called the profit and the edification of our souls. And that is information. In public health, we called it informing to motivate, but information that will help us all to realize that we have an opportunity to have better health outcomes. One of the things, Shantae, you can roll the thing there.
We're just gonna, if you can just introduce yourself, Janice Guider, with your background, and then we want to give the opportunity to the panelists to also introduce themselves as well.
I'm sorry.
So please just share a little bit about yourself and your background,
okay,
and then we'll move from there.
You are determined to make me talk about me, aren't you?
Okay, just for a minute. Just for a minute.
Okay. Currently, I sit on the board of the DuPage County Board of Health. I sit on the board of the DuPage County Early Childhood Education Collaborative, the steering committee. I am a member of the oh goodness, the Good Samaritan Community Health Council. I'm a board member on the board of directors for Forward DuPage. Shantae, is that enough?
Yes, it is. Thank you so much for that. Now we're just going to go on to
everything I do is focused on improving health outcomes. Okay, thank you.
And thank you so much for being here with us today. Your background is the exact reason why we wanted you to be here. So we're going to now go over to our panelists and allow them to introduce themselves. Faith, please.
Good afternoon. Happy Black History Month, Black Appreciation. I'm just grateful to be here. Thank you so much, Shantae. So my name is Faith Young, and I am the Faith Community Nurse, and I am with the Amita Mercy Medical Center, and I am focused on promoting health and wellness in our African American churches in Fox Valley. Thank you so much.
Thank you, Faith. Maggie?
Good afternoon, everyone. My name is Mike-Annette Mengesha Cribbs, although my church family knows me as Maggie. So as my panelists are referring to me as Maggie, I have been a member here at Maine for about the past 7 years. And as far as my professional background, I have a background in psychology, and I will be speaking from a mental health perspective for this presentation. And my role currently is as Director of Programs at Wellness House, which is a cancer community support center. So I have a specific background in psycho-oncology support services, and just so excited to be here with my fellow panelists, and looking forward to a great discussion. Thanks, Shantae.
Thank you, Maggie. Next up, we have Alex.
Hello, my name is Alexandria Sparks. Alex is fine. I am a registered nurse. I have been a nurse for 17 years. Gosh, I can't believe I just said that. 17 years and 13 years in my current position at United Healthcare. I am a clinical manager for a disease management program, which manages people who have chronic kidney disease and who are also on dialysis. So thank you.
Thank you, Alex. And next, Whitney, please.
Good afternoon. My name is Whitney Smith. I am a patient care tech at Rush Copley Medical Center. I've been in healthcare for 15 years, and I've worked in a variety of settings, from long-term care to rehab to home health care. And I am excited to be on this call.
Thank you. Thank you all so much for being on this panel and sharing with us today the lessons learned from your different areas of expertise and helping us to get on the path forward. So again, thank you so much for being here today, and also welcome to everyone who is on the call. Before we get started, I do want to share just a disclaimer, just to make sure that we are all aware. Today we're sharing information with you to hope that you are having a better life, a better experience. But we do also want you to be aware that this is information only, and you should seek the advice from a professional, and with the goal of achieving personalized care. So I did want to share that. Even though we do have experts on the call, we know that everyone's situation is different, and we want to be sure that you get the appropriate care. So I just wanted to take a minute just to mention that. So thank you. So now we're going to go ahead and get started. We're going to kick this off with Janice Guider, and she's going to talk to us about what the data shows and how COVID-19 has impacted our community. Once she's done with that, we will move into health equity, the barriers associated with that, and how we get around those barriers. So Janice, I'll hand it over to you.
Okay, first slide, please. Okay, we know what the data says. We know that this virus has impacted or affected African Americans in the worst possible way. And And if there's anything I want you to really focus on this page, it is that COVID-19 is currently the third leading cause of death for Black Americans. Let's keep in mind that 2 years ago, there was no COVID-19. It is already up there with heart disease and cancer. And the reason for that are many, but if you look over where we talk about social determinants of health, where people are born, where they live, play, attend school, work, worship, where we are right now for so many of us works against our health. And when this pandemic began to surface, because of the pre-existing health disparities, it affected us as well as our Hispanic and Latinx brothers and sisters in a very, very harsh way. We began to carry the burden. Something I thought about, and I wrote it here last night, there was this collision of poverty and what was already known as health disparities. And the burden just ballooned. As you can see from this slide here, African Americans and non-Hispanic persons are, in terms of cases, cases were like millions of times more, that's not million, hundreds of thousand times more likely to be exposed to the virus, and therefore we had that many more cases. Hospitalization was pretty much the same. We were 2.5 times more likely to be hospitalized. Next slide, please. And some of the reasons for that had to do with our existing comorbidities. But before we get to the things that affect us health-wise, let's look at our environment. In a lot of our African-American communities, we live in closer living quarters. We work in closer, in quarters where people are more closely working together. We couldn't avoid a lot of the factors that made us susceptible to this disease. Unfortunately, we have weakened immune systems. And someone may ask, well, how does that happen? It happens because of chronic stress. It happens because of obesity, diabetes, hypertension, cancers, heart disease, arthritis, lupus. All of these diseases are very, very common in our communities. And I recently asked the question, why? I don't have the answer. I just sometimes like to ask questions. And one of the things I'm going to do as we go through this process, if you hear something, a word used or a phrase that you don't understand, please write it in the chat and we will give you more information about that word. And for example, immunity, a lot of us don't even know what our immune system is. What is immunity? And it's nothing but our body's ability to protect itself. And that's affected when we are on certain medications, especially steroids and chemotherapies and certain blood pressure medicines. The immune system is weakened. And because it is weakened, we become more susceptible to severe disease. And something else that's just really hit me as I'm learning more about this, obesity. And this is something that we, on some level, can control and must take control of. But because when the body is overweight, it has to work harder, especially the lungs, to give us the air that we need to breathe. That affects our immune system. That depletes our immune system because it's overworking our heart. It's overworking our lungs. So these are things that we have to become, for the edification of our souls, we have to become more conscious of. No vaccine is 100% effective. Now, initially, when the vaccine was introduced, we all thought, we were led to believe, because of the poor messaging, that the vaccine was going to prevent us from getting COVID. That didn't happen. And we really saw that in the last 3 or 4 months when this new variant, Omicron, began to emerge and became so dominant as increasingly what we call breakthrough cases. People were contracting COVID who had been vaccinated. How does that happen? Because first of all, let's remember, no vaccine is 100% effective, but more importantly, we were still in sort of a vulnerable position. And that is something I remember we talked about very early in COVID, was how do we make our bodies stronger to fight this disease? And this was before we even had a vaccine. So at some point in this conversation, because we still have that possibility to fight this vaccine, not to fight the virus, I'm sorry, not just with the vaccine, but with things that we can do to create healthier bodies. Next slide, please.
Ms. Janice, before we move on, there was a question from Phil Fair that was, how about the term herd immunity? Can it ever be achieved?
You know, herd immunity was discussed early in the vaccine, and there was a lot of thought about, well, I'll get the virus and that'll give me immunity. And the CDC came out with a study, I believe it was in September of 2021, that showed even for those individuals who had the vaccine, who had not had the vaccine but contracted COVID, there was no guarantee that they would maintain immunity. So the notion that there would be, that we could look forward to herd immunity has dissolved. This may become a vaccine similar to smallpox, where to eradicate, everybody is going to have to get this vaccine at some point or another. So right now, because again, we are living in the dynamics of a public health, a science event, and we are learning every day. In fact, if you look at this chart here, it shows how the cases have dropped significantly. And this chart was printed out 2 days ago. And even with this, as we read through the data, there are usually some notes that say the data is provisional. And that's because we look at what's happening right now, and then we look at the metrics a month from now or 2 weeks from now, and we have to make adjustments. So will there be herd immunity? I'm not the scientist to be able to tell you that. I know there's been less discussion of that, but in the meantime, we look at the fact that it's upon us, and we ask ourselves the question, what can I do that I am not vulnerable to this virus? And at the same time, I am not mentally stressed by the virus, because, and we'll talk about that later, we are experiencing the kind of mental health needs that we are not even able to meet in this country right now because of this virus and what it's doing to families. I think on the previous slide, it says something like in African-American families, 71% of us have either experienced the death of a family member or friend from COVID, or we know someone in our family who's contracted COVID. That's almost 2/3 of our population. That's a tremendous burden. Here it is, 71% of Blacks know someone who has been hospitalized with severe SARS-CoV-2 or has died from the coronavirus. Imagine the stress of that. And I'm not going to jump too far ahead because we're going to talk about what that has meant for the Black community. Shantae, next slide, please. Next slide. Okay, I was trying to get more current data for Kane County, specifically data that addresses the number of cases, hospitalizations, and deaths by race. And it's not just Kane County, but we are having some difficulties disaggregating the data that is coming down from the Illinois Department of Public Health. So I was not able to get that data, but I just want you to see what it looks like 2 days ago. 1,026 new cases, deaths 22, new hospital admissions 57. And just let me talk just briefly on what hospital admissions mean. If our hospitals are overwhelmed with COVID patients, you can go to the next slide, Shante. What happens is those of us who are living life with other morbidities, we are in a position where our health is now even more compromised because we cannot get in to either have treatments or to see our physicians. And if you look at I DuPage, Will, Lake, and Kane, I don't know how Lake got in there, but Kane County, Will County, and DuPage. Oddly enough, DuPage County has more cases than any of these 4 counties. But part of the reason for that is in Kane County, as well as in Will County, you guys have more farmland, so you're more spread out. And it speaks to when people are living in close proximity to each other, the likelihood of transmitting the disease is that much greater. Next slide, please. So I heard your pastor speak at an event last Saturday morning, and he asked a question: how do we become vessels fit for the master's work? And it goes back to that prayer, that we would be edified by the knowledge that we learn and take that knowledge and use it. We know health disparities are out there. We know cultural incompetence is out there. We cannot allow that to be the death knell for us. We have to work around, beyond, and under all of these societal pressures and do what we can do to have the best health outcomes. That's what our physical health, our psychological health, social and behavioral health, environment, and economic health. It's time to heal. And the choice to choose health is yours. Thank you.
Thank you. Thank you. Very, very valuable information. Thank you for kicking us off, Janice. With this setup, we'll now move into the lessons learned discussion. So we know what we're dealing with. We know what the figures are showing us. So what have we learned overall, and what will we do going forward? So we will kick off now the panelists phase of this presentation, and we will dive deep into that. Faith, please.
So thank you so much. So, for me personally, COVID-19, it hit me hard. As you all know, I am a nurse, and so my role is normally in the community. But when COVID hit, I was called back to the hospital. So it was grueling. And I think that all of us have come through COVID, and just as we're reflecting, which I think it's important for us to do, it's really important to understand, what have we learned through this experience, and what are we bringing with us? And so another a part of COVID for me was the painfulness of losing family members. So I actually lost 7 family members within the last 18 months. So that has been a challenge as well. So it's not that I've not been affected, but I've learned some lessons, and I think really we all have. So in my role as a faith community nurse, I'm constantly being updated about African American health in our region. So I kind of knew what I have been, working on and the value of that. So it probably would not be good if I sugarcoated, just the facts, because the truth of the matter is, African Americans are in a health crisis, right? And it's even, we're not immune from that here in King County. Although we're only about 5 or 6% of the population, before COVID, we had the most preventable hospitalizations due to diabetes. We had 4 times that of Hispanics. We have the highest number of deaths from strokes in our county. We have the highest number of deaths from heart disease. We have just an amazing number of hospitalizations due to high blood pressure. So for sure, there was a reason for action with African American health, and it was really painful for me, how COVID impacted our health. And so one of the things that the health department, when they were doing an update for us, because that's one of the things the health department has done is, I try to have them come in every year and speak with our pastors and leaders and health leaders and kind of give them an update on African American health. And so that's kind of what this slide that you're looking at is all about. And this to me is our good news. So get ready for the good news. So they shared with us, what determines health of a population. And so this here is kind of like the secret of our comeback. So that's what's really exciting to me. So when we look, and it's really eye-opening, because health and what determines a population's health is not what you think. So one of the things here, it says medical care. So when we look at a population's health, a quarter of it is determined by the medical care that is available, right? And then if you take out just the small percentage that has to do with how we're born, genetics, that's only like 8%, right? So then we have almost 75% that is our health behaviors and our social and societal characteristics, which is fabulous for us as Christians, because our culture, gets really set around our church. For those of us, that are Christians, we do a lot of our work, play, fellowship, right here at church. So there is an imperative, right, for us to begin to encourage one another in our health. And that's what's exciting to me, because that is what I've seen. So out of the COVID-19 pandemic, I have seen an increased response to health programming and my ability to deliver health programming in churches, because now people are engaged in a way that they've never been engaged, right? So even like our clergy leaders, for instance, I think somebody was sharing this yesterday, that was in the holiday wellness that we did. We're doing now programming that no one is doing, but so many people now are interested. I think at the last holiday health and wellness that we had 5 senior pastors involved. So that is, for me, that's record breaking. So I just want to encourage us that, continue what you're doing. If you're on this COVID-19 discussion, if you decided to zoom in at 4 p.m. on a Saturday, you're interested in your health. And I celebrate you and I congratulate you. And I just want to encourage you. We are seeing positive changes in our health, and in the church community in Kane County is leading that. And it is not going unnoticed. I'm getting calls from New York. I am getting calls from the health department. They are seeing what we are doing, that there's a change and a shift. So I just want to encourage you, and I just want to thank God for what's going on here. And I want to open it up to my other colleagues on this Zoom, but it's exciting. Stay tuned. Keep going. We're in this together.
Thank you, Faith. I love the positive attitude that you have. And you're right. We are empowered to make a difference. So let's kind of, bring in the other panelists and get them engaged in this conversation. Lessons learned. Where do we go from here?
Good afternoon, everyone. This is Maggie Mangesha. I appreciate Faith, everything that you said, the good news part, and I want to make sure that gets echoed in my sentiments as well. However, I'm going to start, just by highlighting some of the disparities, because I think that that's an important place to build a narrative around what the mental health is piece. And then as I'm passing it off to my panelists to also contribute to the good news, right? Because we want people to walk away feeling more aware, more empowered, and that's really the whole benefit of this panel discussion. Ms. Janice Guider provided an overview of what the data says about the general impact of the pandemic, right, among the Black community. And so again, I just want to add more of the narrative around the Black experience. So on one hand, COVID-19 was really seen as this a way to an equal opportunity pathogen is maybe what people have referred to it in the past, really causing destruction among communities broadly, regardless of your background. However, due to inequities across society, as well as disparities in health and, whether it's physical health or psychological health, access to good medical care, there was devastating loss, and the toll that it took among our African-American community was really catastrophic. And so that's a reality, but I want to just back up a little bit of pre-pandemic. And folks, we didn't have a super strong history as far as mental health treatment prior to COVID. And so I say that just to really understand the lay of the land is because we have this disproportionate rate of mental illness, and continues if we're talking about severe mental illness, continues even more if we're talking about suicide and addictions across the board, substance use. So as this is growing and growing, this disparity, across Black adults in comparison to whites, and then we lay in, the trauma of the pandemic. And so that's the lay of the land from the mental health perspective. Again, we will get to the lessons learned piece and the good news about it. But for all the reasons that we know, and some of them have already been outlined, increased poverty due to population dense conditions, increase in homelessness among our community and incarceration, increased fear of getting infected, right? This is a reality. I think some of us, maybe even on the call, are in this state, right? This fear, this general fear, and how that's impacted essential workers. Ms. Janice highlighted the death toll. And so if we know what that means for grief, right? There's a natural process of grief that takes place. I think the statistics were something like 70% or something like that. But, this means that Blacks are 3 times as likely to know someone who has died from COVID in comparison to whites. And that's just one person. Now, if you're adding multiple deaths, right, that means multiple grief that is unprocessed, right? What we know about grief is that there's an opportunity to come together and to have a funeral, and all of these things, our natural ways of coping, were disrupted. And that created, major challenges to the grief cycle. And I just want to quickly say a little bit about this constant state of vigilance from the psychological perspective, and what that does for us when you're in that constant state of vigilance, that inability to kind of come down to baseline, how that is the perfect ingredients for anxiety, for depression, for these common mental illnesses that are so prevalent among our community. And then if we tie in the challenges in accessing treatment and all of those things, that can really kind of lead to this storm of an environment, which is where we are. So I want to just say that in addition to all of these things, our coping mechanisms are taken away. How do we gather? How do we feel better? I think if I were to ask everybody, what is it that you do to access support, it would require the comfort of someone else. And that's exactly what we were deprived, right, from being isolated. Although it was necessary to keep us healthy, it was at the cost of us being able to cope in the ways that are comfortable, to come together as a church community and all those things. So I want to just highlight, so I can bring in my other panelists as well, some of the lessons learned to add to Faith's point is that boy, we learned a lot about therapy through the online perspective. Accessing support in a virtual space has become a common way of accessing legitimate, good quality care. And the pandemic helped us move that along in really expeditious ways. I also just want to highlight the resiliency of our community. That goes without saying. Even though the pandemic tried to kind of intercede in ways that really highlighted and compromised us in authentic ways, that there was an opportunity. Here we are coming together to raise awareness during Black History Month to really highlight how we can cope better. So I want to bring in my fellow panelists.
Thank you, Maggie. Just piggybacking off of what Maggie has discussed in regards to, our mental health. The population that I manage, people who have chronic kidney disease and those who are also on dialysis, this population, already has a history of depression because of being on dialysis, or because of knowing that their kidneys are failing, and if they may have to go on dialysis if they can't get a kidney transplant. So we see a lot of people who are managing depression, and we know that it's very, in addition, adding COVID-19 onto it makes it even harder. Now it's another layer that's being added. They're already depressed, and now it's probably getting worse because now they're at home. They're not able to go out as much. They still have to go into the dialysis facility, those who are on dialysis Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, whichever they go. But I can see how that can be very depressing. This population is at a very high risk of infection. They have to be very cautious of the things that they do each and every day to make sure that, they are staying safe, because they're more prevalent to be in the hospital. If they get COVID-19, more than likely they're going to be in the hospital. More than likely they're going to have to stay, and they could have many complications. So we have to try and do whatever we can to help them stay safe and stay protected. With kidney disease, we all know that if you talk to someone in your family, a friend, or someone, you can ask them if they know someone who has who's been on dialysis, who has a CKD, and they're going to tell you, yes, I have a friend, I have a family member. So we all know how prevalent this is in our African American community. African Americans are almost 4 times as likely as whites to develop kidney failure. But while African Americans make up 13% of the population, they account for 35% of the people with kidney failure in the US. And diabetes and hypertension are two leading causes of kidney failure. And as we know, those two, diabetes and hypertension, are high on the top. They're in the top 5 list of the leading causes of death in our Black community as well. One thing that we have learned through this pandemic that has happened actually was a bill that was passed, the Senate Bill 1854, that was passed signed by Governor Pritzker. This is a bill that will now allow the testing for diabetes type 1 or type 2 at an earlier age. And also the testing for vitamin D, which is, something that we need to help our immune systems. So it's the testing of vitamin D at an earlier age as well. So these are some great lessons learned, and I appreciate Janice providing that detail to us as well. But in addition, what I have learned as far as working with these members is that we have to make sure that our community is receiving the care that they need, that they are being, that they know to go to the doctor, that they have access to their doctor. And how we do that is exactly what my other co-panelists have talked about, is getting out into the community. We have to be visible. We have to be out there and talk to people, let them know through our churches, through our friends. Provide education is key. Education about the diseases, diabetes, hypertension. We have to work on these things because these are the things that are causing the deaths in our community. So if we can work on, what's ground level, then we can then help our community live and to thrive and to live longer. Even if, they possibly catch COVID-19, it might not be as harsh on them because they're healthier. So that's all that I wanted to bring a point to. I'll pass it over to our other co-panelist, Whitney.
So one thing, like Alex was saying, to piggyback off of what Alex was saying, is extremely important to, go to your doctor. African Americans are more prone for having diabetes and chronic kidney diseases. And one of the things that we saw in the hospital actually was newly diagnosed diabetes. There were a lot of people who did not know that they had diabetes and had went for a long time with the symptoms, but didn't recognize the symptoms, nor had they seen a doctor, nor did they have a primary care doctor. They were just so used to going about everyday life, working, and that was about it. They didn't take the time to, really be proactive about their health, or even pay attention to self-care. And one of the things, like Maggie spoke on earlier, is our ability to cope, and how she spoke about grieving. And we were grieving many things, right? Like, so, there were a lot of people that passed away from COVID, but, their deaths weren't the only things that we are grieving. We are grieving not being able to communicate with people, physically. When even something such as a hug, we couldn't do. And when you hug, it releases endorphins. And things such as those, we couldn't do. And we saw an increase in the hospital in patients that were depressed, and an increase in COVID patients that also had newly diagnosed depression. And with that being said, one of the interesting facts that I did not know was that people with depression are more prone to, or at a higher risk of getting COVID, because it lowers your immune system. So I would definitely say one of the things throughout this pandemic that was learned, it was, it's very important to learn how to cope. Sometimes, like in the African American community, one of the things that we do is, we go to soul food. Soul food, it tastes good, but is it really good for the body? And it's probably not something that we should have every day, right? Having it, soul food Sunday, that's fine, but that's not something that we should have every day. But unfortunately, sometimes a coping method would be turning to food such as that, which, throughout the pandemic and not being able to go to the gym, and just turning to, food as a coping method. And, the food's high in carbs, high in sugars. And unfortunately, that can lead you on the wrong path later on. That can lead to, diabetes and hypertension and being, not being active. Also, one of the things that we learned through the pandemic is just how important it is to have regular checkups with your doctor every year. It was amazing to me to find out, how many patients had not seen a doctor in years and didn't have a primary care physician. And that's why those annual physicals are very important, so that you can know your numbers, you can know where your A1C is, especially if you have a family history of diabetes. It's very important, that where your numbers are at, even, annual blood work, so that if you have a deficiency in potassium or vitamin D or any of those things.
Shantae, may I say something, please? Okay.
I think she's on mute, but yes.
Yes. Go ahead.
Oh, I could just hug you ladies. Okay. I want to go back to Senate Bill 1854, because at some point we, and particularly those of us who are public health professionals, we have to become public health activists, as Faith is, right, Faith? Okay. I remember one day so clearly watching one of those news reports about how 3 out of 4 Black people were dying from COVID. And my brain just would not let me rest, okay? And I began to look at the literature behind what was going on, that so many Black people were dying. How do Black people even come into a hospital emergency department and be diagnosed for the first time with diabetes? That just really did not register well with me. And I thought back to the last community health breakfast you had, Faith, and there was a minister there who talked about he had gone to see a doctor, and the doctor diagnosed him with overactive bladder disease. Okay, it was only after he was in an automobile accident, because he's driving on the highway and he loses his vision. And that's one of we call it disease sequela of diabetes. It can cause you to go blind. It can take your limbs away. And this is why we have to, as a people, start getting very uncomfortable with diabetes. I refuse to call it the SUGAR word, because there's something sweet about it. This is a disease that is killing us. It is one of the 5 leading causes of death in our communities, and it doesn't have to be. But as I started going through the studies, and Johns Hopkins did a very thorough study, a retrospective study on people who had died. And it was something like 3 out of 5 people who were Black had diabetes and didn't know it. And that bill, Senate Bill 1854, came about because I couldn't sit still. And this is what we all have to do. I wrote a white paper and I called my state senator and I said, what can we do to change this? Because before that, you had to be like 60 years old before your doctor would offer you a A1C test. And this is a test they can do in the office. And the study also showed if you had low vitamin D sufficiency, you were more likely to die. These are very inexpensive tests, but we are not being offered these tests. So we are going to have to learn to become advocates, self-advocates, knowing what diseases permeate our families, knowing our family history, knowing our communities' history, knowing how disparities impact our lives. And I'm not, when you think about that impact, think about the potential loss. Think about the economic loss in our community because of disproportionate health concerns, the burden of health. We are losing because of our health. Without our health, what do we have? Mm-hmm. So I employ all of you, go back to that prayer for the edification of your souls. Start thinking, what can I do? And we're going to have that discussion in a few minutes. What can I do to change this paradigm? What can I do so that I'm not just healthier, but my children, my grandchildren, my fellow parishioners in my church? What can we collectively do to make us a healthier community? If we get that out of COVID, then I'll say something good came out of this disease that came in and just knocked us to our behinds, okay? But let's walk away today with, I can be that change. Sorry I took so long.
No, thank you. Thank you. I love your passion. And you're right. You're right. We have to make a change, and it starts with us. And we are empowered. We're empowered to make this change. I think you all shared some great information. Before we move on to myths and facts, are there any closing comments regarding lessons learned that anyone on the panel would like to share? Okay. Okay, well, thank you. Thank you all for sharing with us from your perspective.
Shante, let me just add this though, just
sure.
because, I know now I'm being long-winded. So just the thing is, during one of the things that happened to me, because I always like to be transparent, because I don't want to seem like, I'm coming from this tower where I have my health together and I'm, giving out all of this pseudo wisdom. So for me, COVID-19 was really challenging for me health-wise as well. When I was finishing up a funeral for my aunt, I went for a jog and ended up breaking my ankle, but no big, there we go. But it also, so I gained a lot of weight. I gained a lot of COVID weight, or how you want to classify that. But during COVID, I gained weight. And one of the things that has been plaguing, that really plagues my family, is diabetes. I mean, I know that we've been harping on diabetes, but it hits really close to home for me, because that is like the disease of choice for my family. So I'm talking about cut off limbs. I'm talking about kidney dialysis, the whole nine. And so each year, my blood sugar, my fasting blood sugar had been increasing. And for the first time in my life during COVID, I tested in the pre-diabetic range, and I was floored, right? Because I know that every time your blood sugar is out of whack, every time those numbers are not so where they should be, that it puts your internal organs at risk, right? It just does. And so I was extremely concerned. What am I going to do? So thankfully, one of the programs that we did here over the summer, it was just a program that I was able to do. I did it with a group of people, in our health network. And it was incredible. And all this was changing our diets and making it more plant-based. That just means more fruits and vegetables, right? That's what the focus on. So I took this to I took this program to my doctor, and she was ecstatic when she saw it. Okay. And she's like, you got to do it. So this was just for 15 days, right? So they checked my blood sugar going in, and it was one way, and they checked it going out after eating a certain way, and the numbers told the story, right? So for the first time in my life, I'm empowered to know I do not have to get diabetes. My whole family, it's running rampant, but I do not have to. So I just want to encourage all of you, because I know that there is just a new look at health that is going on. And I just want to encourage you that continue with the changes, that you are making. And do not get discouraged. We are all in this together, and we are improving. Thank you, Shante.
Thank you, Faith. Again, thank you all for sharing your perspectives. Very good information. And I think that we all feel encouraged to take control of our health, right? As you mentioned, know your family history, have your annual blood work completed, look at your diet. Are you getting exercise? Those are all things that we can do. And just doing those, simple things really can have a huge impact on our health. So I just want everyone to feel empowered to do those things. So great conversation. As I mentioned, we're going to now navigate to the myths and facts section of the conversation. So we will get that pulled up. And then during this time, we would like for...
Shante,
I'm sorry.
Oh, sorry, Shante. After you finish this, I think there's one question in the chat. So I at least wanted to address the question that was in there.
Sure, go ahead. What is the question?
Oh, okay. I think maybe Maggie, maybe you'll take this one, but I could be wrong. This is from Joyce Smith. It says, African Americans tend not to seek out professional mental health support due to the serious consequences of COVID that are being felt: financial illness, death, seclusion, etc. The mental health community realized an increase in African Americans seeking those services. Are there existing programs/services to attract people to these services?
It's a wonderful question. I mean, I think so I want to say in general that there has been so many efforts and so much acknowledgement. Maybe that's the silver lining of COVID, that that the psychological services as an institution needs to develop increased cultural competency in the ways in which services are provided, the types of modalities that are used, so that they can be much more culturally considerate. So I think that there is attention in productive and advancing ways that feels good and helpful. However, I think that the bridge that still needs to be crossed is addressing some of the misconceptions and fears and an invitation from us as a community to say that therapy is okay, that therapy is going to be a part of culturally how we cope. I appreciate conversations such as this where we can be saying these things directly, because this is what this is what needs to happen, right? We need to demystify what happens in therapy, because I think there's a lot of illusion behind what happens when the door is closed. So I think that we have made some advances, but we still have a long ways to go. And the point that I want to really highlight is that what happens in therapy is not magic, right? It takes some level of openness, and that's something that we bring. That's the work that we can do. That's the change that we can invite and challenge ourselves and task ourselves to consider. That, as my panelists have mentioned before, the priority has to be on kind of reclaiming our health, our physical, the standpoint I'm speaking of is our mental health. We have to prioritize it. We have to make it a priority in tangible ways. And that might mean embarking on new methods of coping. And so being able to start by having open dialogue around depression and not just calling it the blues or something that will fade is one real way to do that. So I so appreciate the discussion.
Perfect. And it looks like there's some other comments in here. I won't go over them, but it looks like we've got some people taking charge of their health and following up with their doctors about either test results that have improved or test results that they are concerned about. So again, if you have any specific questions, I'm sure any of the panelists will be willing to help if it's in their area of work. So as Shantae said, we are going to move to a myths versus facts section. So we're asking for some audience participation, which you guys have been doing a great job of so far. So I think, Shantae, are you going to read out the questions, or would you like me to?
Go ahead, please do.
Okay. So essentially, to our audience, our guests, please put in the chat what you think your answer is, if it's a myth or if it's a fact. So essentially, a myth that it's untrue, a fact that it is something that is true. So the first one that we have up is, if I've already had COVID-19, I don't need a vaccine. So this, okay, we look like we have somebody else that has put that it's a myth. Myth, okay. Myth, okay. It looks like most of our guests think it's a myth, which I believe it is also a myth, but I don't know if someone on the panel wants to speak to this one.
It is definitely a myth. In fact, studies show that if you had COVID before and you are not vaccinated, your risks of getting reinfected is 2 times more higher than those who got vaccinated after having COVID-19.
Great, okay. Thank you for that information, Ms. Janice. Okay, so our second question here is, people with kidney disease are at higher risk for developing serious complications from COVID-19. Is that a myth or is it a fact? Fact, okay. Fact.
Yes, everyone is right with the facts. Yes, kidney disease, people are at higher risk when they have kidney disease. This is actually something I had touched on earlier in regards to why we need to make sure we're keeping our family members and friends safe, those ones who we know are on dialysis and know have kidney disease. We want to make sure that they're wearing their PPE when they're wearing their mask, and we're keeping them safe. They're washing their hands. They're not being around a large crowd at times, and that they're just being careful. So yes, it's very true.
Okay, great. Next question here is, this is an interesting one. Therapy is for white people. Myth, okay. If someone says fact, I guess I'll
because I would have said BS.
Okay, so I think we all know it is a myth. Maggie, are you going to discuss this one?
Yeah, so not a surprise, right, that it's a myth. However, I think the cultural, norm is that's kind of the running dialogue, right? Is that therapy is that's something white people do to cope. And so, I mean, it's, I put this in, and it was kind of a clear myth. And I say that to say, okay, so what does that mean? How likely or how open are we then to engage in therapy as a part of our coping? And that's kind of the next piece. If we know that it's effective, which we do, in decreasing mental illness, in increasing opportunities to advance, to build our coping mechanisms. And we've already recognized that the level of stress and distress is so high among us as a people, then it is an option, right? And so whether it's a sliding scale option, again, through the pandemic, opportunities to not even leave the comforts of your home to access therapy are pretty common now.
Okay, great. And so I think Nurse Faith actually had a great comment here that therapy is also for Christians. Which I think is also important to know as well. Okay, so we have our next question is, scientists rush the development of the COVID-19 vaccine, so its effectiveness and safety cannot be trusted. Myth or fact? I mean, if you believe it's a fact, this would be the time to say we can have some healthy discussion about it. So it looks like everybody has said myth. I would agree it's a myth. Who on the panel is taking this one?
Oh, I guess I am. Coronaviruses have been around for hundreds of years. And I'm not sure why we did not know that, but that seems to have become a big surprise. Even though it seemed that, and let's be honest, the development of the vaccine was faster than what we normally see with development of any pharmaceuticals or medications, but there was a need to have the vaccine because remember in the beginning, hundreds of and thousands of people were dying daily. Now, does that mean it bypassed any of the protocol that is long established by the FDA? Absolutely not. The vaccine went through clinical trials, clinical trials, and under the auspices of the Federal Drug Administration and then the CDC, the vaccine was approved initially on an emergency basis. And then as more tests and studies were done, the FDA gave it, I believe, its final approval, I want to say back in November or December of last year for the Pfizer and eventually for not the Johnson, what's the other mRNA vaccine, ladies?
Moderna,
yes. So the effectiveness and safety of the vaccine is there. But keep in mind, the purpose of the vaccine is not to prevent disease. It is to prevent severe COVID disease. So just like we get our flu vaccines annually, and I hope we all are getting our influenza vaccines, it doesn't prevent the flu. It prevents severe disease. And unfortunately, the original messaging was that even though no vaccine is 100% effective, unfortunately, the original messaging by the other administration was that the vaccine would prevent. No, it's what is it, 91%, I believe the Pfizer is effective against the disease, against severe disease. Thank you.
Okay, thank you for that, Ms. Janice. So I think this is our last question. Steadfast and consistent prayer can reduce or remove depression from your life. People can pray their depression symptoms away. Myth or fact? Okay. We've got some myth answers. I haven't seen a fact yet, I don't think. So who on the team is taking that?
Yeah, this is one that I am happy to take. And so this one really just highlights, just as folks are saying, the integration and the combination of both spiritual support and, for depression or maybe even more severe mental illness, especially, the benefit of therapy and the benefit of medication. And those have typically been, discussions and conversations that we don't readily have in our community, and we don't readily have in the church. And so this is an opportunity for me to just thank Pastor Spencer, Pastor Dallas, because there has been recognition from the pulpit that, yes, prayer is an integral place to start and continue. However, there are some people who pray and still manage depression. And so we have to, as a community, be open and honest about talking about the benefits of multiple coping mechanisms. So faith and prayer and a therapist and medication. And sometimes that is the only way for decreased symptoms and for one to really live a full life and manage their mental illness.
I love how you said integrating the two. I think, and this is one of those barriers, that there are people who believe it's a sign that their faith is not that strong if they see a therapist. And I've actually said to people, well, if you have cancer, you see a doctor, you see an oncologist, right? And that's no reflection of you not having faith in God. So if you're having some coping issues or stressors in your life that you need someone to sit down and help you map through, it's not an indictment against your faith in God that you see a therapist. God gave us therapists too. Would you agree with that?
100%. And I'm so happy that you're highlighting this, because I can think of so many individuals who, usually by the time that one seeks out support, whether it's from their pastor or, from, someone within the church community, usually they've been managing, struggles for a long time. Right. And so I'm thinking about the folks who I know are steadfast prayers and who have reached out and who have tried to lean into their faith as a way to manage their depression, and how invalidating it could be to then receive the message, just pray more. Right. Because that's an opportunity to say, yes, continue to pray. And, here's some referrals. Here's some opportunities for you to see a therapist. And have you considered medication? Is that something you're talking to your therapist about? Continue to pray, and so opportunities like this, I'm just, again, so thankful for an open dialogues where we can. This is at the church. We're talking about depression. We're talking about medication. And I know of other church communities where these discussions are not necessarily as open. And so I'm thankful. I'm thankful for so many things, but that in particular, and that because I do believe that this integrated approach is how we can address the whole person. Address their spiritual needs, address their physical needs, address their emotional needs, in a way that can really lead to important change.
Great. So, yeah. So in the chat here, we have one, I wanted to mention Nurse Faith's comment about the Lent research study for those people that are looking to either lose weight, lower their blood pressure, cholesterol, or blood sugar. She has a plan to be all in with the link that's there. So please take a second to view that link either now or later on. It looks like some people have also co-signed on the fact that working out definitely helps with depression. And then Antonia has put that some also believe that their faith can protect them from COVID as well. I don't know if maybe Maggie or Miss Janice, if you guys want to take a second to kind of touch on that. And then secondly to that, there's a comment from Samantha about what are some resources for children who have some depression issues. So I don't know who wants to take on those two questions that I think are really important.
Mm-hmm.
Yes, absolutely. I'm sorry, I was reading and listening at the same time, so now I'm not sure which question.
Oh, that's fine. So the first one is about that some also believe that their faith can protect them from COVID as well. So I'm assuming that it's talking of,
Can I give
Tony,
you an answer to
correct me
that?
if I'm wrong, that people believe not in getting the vaccine, but rather praying. Yeah.
Okay. I know someone, he and his mother died 1 week. The son died, the mom died 1 week after her son from COVID. Neither one were vaccinated. They were both seemingly healthy people, no obesity. He was a person who worked out, lifted weights, ran, and he just believed that his faith and his own health would sustain him. And he and his mom died 1 week apart. The short answer is, and I just thought about something I heard a pastor say many decades ago: let's not trample on faith. Okay, God did not give us this wonderful gift of faith to use it unwisely. So let's look at faith for what it really represents, and that is that connection with God, that belief that He will empower us to do the things that we really need to do to make our lives full, okay? But the Bible also says to seek knowledge and wisdom. And I'm oftentimes confused by people who talk about their faith will do this for them, and yet they don't seek knowledge, they don't seek wisdom, they don't seek understanding. So let's be wise here and understand that and believe and have faith that God has given us this wonderful thing called science. And the science is there to help us protect and nurture our vessels, these wonderful bodies, this wonderful gift of life. And let's not believe that our faith will protect us from COVID the way a vaccine will. You can have faith but still do the things that you have to do.
Perfect. Thank you, Miss Janice.
Mm-hmm. Thank you. Thank you very much. Good conversation. I think that the myths and the facts kind of, generated some additional thoughts and some additional conversations and paths for us to go down, which were really great to share. So now we're going to move into the questions and answers phase of the program. So we now want the audience to come off mute and ask any questions that you may have for the panelists.
So it looks like we have one question already that was typed. So maybe we can start with this one while the rest are getting their thoughts together. Can someone speak to antibodies after having COVID-19? Is there a time frame of immunity?
Okay, so I guess
trying
I'll
to
take.
find my new key. Yes, does someone else want to speak to that? Faith, go ahead. I'm trying to respond.
Yeah, and you can chime in as well. So the problem with that is it's a little bit unclear, right? So you can get COVID, and the thought prior was like at least you have like 90 days, right, of immunity, but that gets complicated, right, by these variants. And so now you really have to. There's a gray area now, to where it could be, 30 to 90 days. And so it's just not specific enough to say, I got COVID on this day, and now I don't have to, worry about it, or I can be around somebody that has, COVID because I've had it. It's just not defined in that way right now. So you have to continue to follow the guidelines of, if you know somebody that has been infected, that you don't interact with that person, and that you social distance as much as you can, and wear your mask. So that's a really good question, though.
Okay, so it looks like someone has chimed in to say, and I see you guys raising your hand, so I'll go to you guys as well. It is generally 30 to 90 days. However, there's not any set immunity level that would distinguish an absolute immunity. So that's in line with what Nurse Faith said. I guess I didn't see whose hand went up first, so I'll just start with Antonia Harlan. Do you want to answer or ask your question?
Yes. Could you discuss the importance of understanding being asymptomatic and having COVID, which a lot of people may not understand how that works?
Maybe Ms. Janice, do you want to take that?
Okay. Okay, I want to make sure I understand the question. She went somewhere on the screen. Being asymptomatic and
Yes.
having COVID?
Being asymptomatic and having COVID, because most people think they have to show symptoms.
Okay, I got you. Okay.
Okay.
I think it's like with any disease, if you are not symptomatic, you are considered asymptomatic. I want to make sure we all understand what asymptomatic is first. And you can be asymptomatic. In fact, there are cases early on in the disease where we found a lot of children were asymptomatic, but were carriers of this disease. They didn't have the nose, they didn't the nose sniffles, they didn't have the sore throat, they didn't have that general sense of tiredness. So no one would have ever guessed that they were symptomatic. And that was one of the reasons, and I don't want to go political here, but that's one of the reasons the argument is to keep masks on children in school, because children can be asymptomatic and still be carriers. And we just don't know. So if you have children in school, without overwhelming them, I would suggest that you just explain they can still protect themselves, even though others may not wear masks, by simply wearing their own masks and still try to maintain some physical distance from other students, especially those who are not mask wearers. Did that help? Okay, thank you.
Great. Are there any questions there, Tajane?
What did you say?
Are there any other questions?
I thought I saw somebody. I'm just gonna mix. It had like Zumba in the name, I thought. Is that right? Was it Tamika? Was your question answered?
Yes, my question was in the chat. It was the first question that you answered. Hello, everyone. I have the opportunity to speak to positive COVID cases on a daily basis. And this is something that they bring up all the time. And it's residents in the community that we serve with. And I believe that they believe, based on our conversations, that they're immune after they've had COVID. And I always refer them to speak to their doctor. I am not clinical. And so I always refer them to speak to their doctor, but more than likely they haven't talked to their doctor in a while. 90% of the people that we speak to in the community, they don't even tell their doctor that they have COVID once they find out that they have COVID. So with that being said, I'm 50% sure that they're not going back to their doctor to have these conversations, even though I've recommended that. So that's why I asked that question regarding, do we still believe, based on studies, if the immunity is 90 days after you've contracted COVID? And we are not sure based on a variance, which just piggybacking off of what Faith said. And so it's important that we really have these conversations with the community that we're talking about, which, you know, those who maybe don't go to the doctor, who may not have a primary doctor, who, you know, maybe low income people, or people who are, you know, working these type of jobs in the factories and things like that, where we're in close quarters and things like that, where you're able to contract these viruses at a higher rate. And so I just really wanted to throw that out there because, you know, I'm in a situation where I do actually talk directly to many people who have COVID and dealing with it currently. And so these are the type of, you know, conversations that come up. And, you know, some of this is unbelievable, but that's one of the main things that happen. They believe that they're immune after they have COVID. If they were able to get through it, you know, they believe that they're immune for, you know, a certain amount of time. And so it's risky.
No, thank you for those comments. I think, Miss Samantha, did you have a question? I think I saw your hand up.
Yes, I did have a question. Hello, everybody.
Hello.
I had COVID prior to the vaccination. And then, of course, I got the vaccination about 60 some days, 90 days later. I had the J&J. Then, of course, I had a booster back here in early fall, or I'm sorry, I'd say about mid-fall. And, of course, I got COVID again at the beginning of this year. And I was not sick the first time around. The second time around, I had more flu symptoms. So I'm grateful for that because I'm like Faith, I've had about 5 or 6 family members that passed over the last 18 months from COVID. So I just wonder though, because when I took the J&J, that was the one-shot deal. And I wasn't necessarily looking for that, but that was the one they had available at the time for me to take. I also had the booster from Moderna, the Moderna. And my question is, because I never thought it was very clear as to whether or not, now that they have more evidence, whether or not people who had the J&J as their initial shot should also get maybe even a second booster for the vaccine, either Moderna or Pfizer. I had the Moderna last time.
All right, who on the panel would like to take this one?
So, yeah, so that's a really good question. And, you know, it's pretty amazing, you know, when you look at, you know, the course of actions here, you know, you did, you know, all of the things that you're being told to do. You know, you got vaccinated, you know, you had the booster, and then you still ended up having COVID. So probably, you know, the response would be is that we're really grateful, right? That it wasn't, it didn't sound like you were hospitalized. Is that correct?
That's correct.
Right. So, and that's kind of been like one of the biggest aha moments for this is that it's having the vaccines did not lower like the incidence, because we saw that spike right in January and February. So it didn't say that you could not get COVID, but what was that you would have a milder case. And we're trying to prevent hospitalizations and death. So for that, you know, I guess the response would be that, you know, things semi worked well here because you didn't get severe disease. And so that's kind of what we're really grateful for. Now, I have not been told that they are giving any second doses of the booster at this time, but things are constantly changing, aren't they? So we're hoping, right? We're right now, we are in a downturn, and we're really thankful for that. Our numbers have gotten really high here in Kane County. And so we're really thankful to see less death, less hospitalizations, and a decreased positivity rate. So I guess the short answer is not at this time for the booster, for a second booster. But I'm so glad that you did all of the things that you did, and I'm so thankful for your outcome.
Thank you. I am planning to talk with my physician also about that, because I thought I heard something on the news saying that they may start recommending another boost, especially for people in certain age categories.
And so
actually, I'm sorry, Faith, go ahead.
Okay, I'm sorry. So, and you just bring up something that's so important. And I'm so thankful that you have that you have a consistent relation with your physician. That is one of the best things that you can do for your healthcare, is to form relationships with your providers, right? It's so important. It's so important. And that's one of the lessons I think that COVID really taught us as well. It's so important that you have a relationship with your provider, because they can look at your health history and look at your health story and make specific suggestions and give you specific directives for your case. So I think that is, I love the fact that you have, a provider, that you have a relationship, and that you're in touch and asking questions. And one of the great things about this whole COVID deal was my chart. So if you've not had access to my chart, and if your clinic or facility or your provider provides that, you can be in constant communication with your providers. And so I want to encourage that as well. I think I might have taken a little bit of time. Thank you, though.
On the other side of that, the FDA did recommend a second booster for those individuals who have certain diseases, autoimmune diseases, cancer, and who are on certain medications. And I believe the CDC recently approved that as well, if you fit into that category. In fact, I have received my second booster because I fit in that category. So again, you speak with your physician, and if he or she or they say you're in that category, by all means, go get that booster.
Thank you very much. Matter of fact, I do my chart, so I'm going to go in and send a message this weekend. Thank you both.
And if I could just piggyback off of, making sure that you're in constant contact with your providers. Also, a lot of people are not aware that your insurance company provides a lot of different benefits for you. So you can call your customer service line and ask if you have a nurse that you can talk to as a case manager, if you have diabetes, if you have kidney disease, if you have cancer. There's a lot of benefits out there that a lot of people aren't aware of because they're just not reading their whole evidence of coverage. So definitely reach out to your insurance company too to see if you have a disease manager, case manager, nurse that will be there for you. You can call them if you have questions on a daily basis. Anytime they should be available for you.
And real quickly, Alex, to speak to that, if your doctor, when we go see our doctors, after we reach the age of 47 for many times, they will ask you, do you feel safe in your home? Do you ever feel like you're going to fall? There is a reason for that. And if you ever feel like you're going to fall, please say, yes, sometimes I feel like I'm going to fall, because that can trigger some much needed paid for physical therapy for you. So when your nurse or doctor is asking those particular questions, please be honest. That's another barrier in our healthcare, is that patients sometimes are not honest with their providers. And if there's anyone you should be honest with, it is your provider.
All right. Thank you for all of that information, panelists. I think we have one more question from Deacon Bill.
Oh, yes. Okay. I'm asking for your opinion that, COVID's not going away. So do you think ultimately we'll just manage it? We think we can just manage it like flu. You got to get an annual shot. You think ultimately that's where we'll be? Because I don't believe it's going to go away.
Okay, who on the panel would like to take the, Ms. Janice, is that you?
I think eventually we will look at COVID as an endemic. It's going to move out of that pandemic phase into an endemic phase. And yes, we will likely treat it like we do flu, smallpox, chickenpox, all these other highly contagious diseases that are now controlled by vaccines, okay? I know there is a bill right now to make COVID a vaccine as part of those early childhood, not childhood, I do so much early, what is it when children are born? You ladies help me, okay? When babies are born, they get certain vaccines, right? Okay, childhood vaccines, okay. I know there's a bill right now that's being developed to cover that, but there's also a bill by the anti-vaxxers to go against that. So we have to pay attention politically what's going on around us and make sure that the government is responding in a way that's going to benefit our health.
And I just want to say quickly, I appreciate your question, Deacon Phil, and just want to say that, what the pandemic has done is really put a spotlight on all the cracks in our, in our physical and psychological health needs. And those will exist beyond, well into the endemic stage of our pandemic. And so again, just to echo that the time is now, continue to be now, to address those, all of the ways that we have highlighted, because those things aren't going to go away unless we take action in some of the ways that we've suggested. So just wanted to say that.
Perfect. So I don't see any other questions. I'll pause for a second to see if anybody else has any last minute questions before we move on to the last segment of this presentation.
I just wanted to add as well, I know we are talking about, making sure that you go to your doctor, have your physicals and your lab work, but make sure also that if you don't have a primary care physician, that when you find one that is going to listen to you. And if they are not listening to your concerns, don't hesitate to go to another physician, because you have to be your own advocate. It is very important that you felt seen and that you felt heard. And if your physician is not listening to you, then go to someone else that is going to listen to your concerns and be proactive about them.
Very good. Perfect. Thank you for that. I think that's such an important point. Shantae, I'll pass it back over to you. Oh, sorry, did I miss somebody?
Is there another question? I'm sorry, before we move on. Oh, there's one more, looks like there.
Oh, how long do we believe before we, sorry, the comment moved. Before we, I think this is supposed to be how long before we get to an endemic status. Ms. Janice, do you want to take that since you were just talking about it?
I am not bewitched. Okay. I don't know. I think I can see it happening and I can guess it's going to happen in the next 6 months to a year, because this is becoming our reality. It's becoming our reality. So all I can do is guess, but I don't know.
Yeah, I did see, just as a side, this is not at all my area of knowledge, that California is like moving to be the first state to recognize COVID as an endemic, I guess, would that be endemic disease or disease of, and I don't know how you really say it, but I did see in the news that is their push Shantae, do you want to move on to the next
Yes.
section?
Yes, thank you. Thank you. Well, good conversation. Thank you, everyone who shared a question. Thank you to the panelists, and also thank you to Tajane for walking us through that phase. We've had some really great conversation. A lot of very useful information has been shared, and I'm very grateful for this time together. We're now going to transition to have an encouraging word shared with us from Minister Brandon Casey. I think it's very important, we're trying to, be encouraged and stay strong, on this journey. And we've talked about, things we can do from a health perspective and spiritually. So we thought, this is, a church event. So we have to kind of, spend some time in the word. So we'll do that now. Minister Brandon Casey, please.
Hello, everyone. Good afternoon. This has been a great event so far, and it pleases me to say that Janice and Maggie both already gave the encouraging word that I was going to give. So that is a blessing. With that being said, one thing I do want to reaffirm is this whole notion of faith and seeing doctors or not seeing doctors, and how faith, somebody even said that they said faith can prevent, or you've heard people say faith can prevent from getting COVID and things of that nature. The Bible does say that there is the shield of faith. And however, when you look at what that says in scripture, it says that the shield of faith is there to quench the fiery darts of the enemy. It's not there to stop you from getting an illness. It's not there to stop you from hurting yourself in terms of an injury or anything like that. The thinking that faith would stop COVID, then you would have to transition that over to then saying, well, then if faith is going to stop COVID, then it would also stop you from getting a strep throat. And then it would also stop you from getting an allergy. And then it would stop you from getting other type of illnesses and sicknesses. And unfortunately, I would dare say that everybody that's on this Zoom webinar today has at some point in their life, at least once, had some type of sickness or illness. Many people that know me already know that I will not hesitate for 1 second to go to my doctor. And it's a lot of times it's uncharacteristic for men to do that. However, if I feel like something is lingering around in my body a little longer than I'd like it to be, I'm definitely making an appointment to go see him. So then therefore, faith is not something that's going to be diminished in your life if you go to see a doctor, or if you get a vaccine, or if you were to wear a mask. Nor does it make you, the flip side of that would then be, it doesn't increase your faith, or it doesn't give you super faith if you say, well, I'm not going to get the vaccine, or I'm not going to wear a mask, or I'm not going to go see my doctor. So Proverbs 3, 5, and 6 says, trust in the Lord with all your heart, lean not to your own understanding, acknowledge him in all your ways, and he will direct your path. And then verse 7, the A clause says, and be not wise in your own eyes. Sometimes we have a tendency to think that we can will our way to do something, or that we have the answers, the best answers that are going to solve all the issues or problems that are going on around us. So in closing, I'd just like to say, I definitely want to encourage everybody to continue to pray, encourage everybody to continue to cultivate your faith, encourage everybody to continue to trust in God. And at the same time, while doing that, I also want to encourage everybody to seek professional help if they need to seek professional help, to go see your doctor, converse with medical professionals, do everything that's necessary to make sure that we as individuals both spiritually, physically, emotionally, mentally, behaviorally, all those things, that we can be whole, that we can be in the best possible position to do the things that we know that we're supposed to be doing for our families, for God, for our church, for our communities, and all those things. So I just want to encourage everybody to, yes, live faith, have faith, pray, but don't think that that's something that should stop you or prevent you from seeking medical attention or seeking professional help should you need to do so. So thank you all for participating in this webinar, and we hope that you were encouraged and edified by the information that was shared by our wonderful panelists.
Thank you. Thank you, Minister Brandon, for sharing those encouraging words with us. As we move towards wrapping up this session, we wanted to share some tools and resources, and we have a list here of those different things. I did capture most everyone who attended today. So if you're unable to, jot these down, we can forward these along to you after the meeting is wrapped up. And also, just for your reference in the future, this was also broadcasted on Facebook Live, so you can go back and review it for further information, or just to kind of go deeper or get more clarity. Or you can also share with other people that the information is also there on the Maine Baptist Facebook page for future reference. I've also mentioned that because you can also reference these tools and resources there as well. So with that being said, I want to say thank you so much for spending time with us today. I also want to say Happy Black Appreciation Month, Happy Black History Month. It's very important for us and our ministry and our church, right, to not only celebrate, our people and our history and our accomplishments during this time of year, but also to focus on the future and how we can become better as a people. And that's why we wanted to take this time today to share information with you on a topic that has impacted our people so much. So again, thank you so much for joining us. I hope you gain information from the experience here, and God bless. Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you.
Thank you.
Beautiful job.
Excellent.
Thank you.
Excellent.
Thank you.
Thank you. Have a good evening.
Faith, should we stay on for a moment?
We can, I guess.